When we look at the overhead squat assessment, you got to do this, right? Very easy, very simple. With both arms overhead, have the client squat. If the pelvis dips anteriorly on the onset of the movement, then they have that anterior tilt that Wendy talked about. We saw the imaging indicating the hamstrings may be long and, are trying to stabilize the pelvis. If the pelvis goes posteriorly on the onset of the movement, that's the key. Then the hamstrings, you'll have that posterior tilt, which means that they are shortened. So it's what happens first. Do they go anterior or do they go posterior? Rarely do they stay neutral. Usually most people have one or the other.
And remember, when you're doing the overhead squat, it's not how low can you go. It's how low can you go to chair height. Because once you go past chair height, you will go into a slight posterior pelvic tilt in order to maintain your balance and keep you from falling backwards. So as Marty said, what do you notice first? A lot of times, if you just raise your hands over your head, if they have an anterior pelvic tilt, you're going to see that if it's a lat situation.